slamming their heads together. That being said, there are important takeaways here. That if you take away something or you add something, right, you're always adjusting it on the other end. And this came up as a question earlier. If we do interventions, there are other things that impact that we maybe didn't even consider. If we take football away from young men and women, are we denying them other opportunities to grow in terms of physical fitness or even character, right? And I don't know the answer to that, and nobody knows the answer to that. If anything, it's just another reminder to slow down in our implementations, to remember that there are any number of things to consider anytime we do anything at all. So just to wrap this up, concussion, not the most exciting topic in the world, but something we see every single day in the emergency department. Kids who come in and bump their head, we're learning more and more that concussion exists on a spectrum with all other traumatic brain injuries. And where we once had this sort of retrospective grading of concussion, grade 1, 2, and 3, we now understand that that's not genuine, and that doesn't lead to a better assessment of what can happen for our patients. We're beginning to understand that this gap between concussion and mild traumatic brain injury, this gap between concussion and cerebral edema or a cerebral contusion, may not actually exist. There are almost certainly structural damage done to anybody who strikes their head, as evidenced by that sort of Banyan fibrillary protein study. There are biomarkers being spilled. On functional MRI, there are interruptions in cognitive function. Something is healing a month later in the overwhelming majority of these kids. How do we fix it? We don't know. We have nothing good yet. We know things that don't work. We know that hypertonic saline doesn't work. We know that magnesium doesn't work. We know that progesterone doesn't work. We know that fish oil doesn't work. We know all these things don't seem to help. We know that strict brain rest leads to worse outcomes than a graded return to play. So where do we end up with all of this? How do you treat a patient who comes into your emergency department with a diagnosis of concussion? Well, A, they need follow-up. And it's a little sobering when we look at these studies and we see so many of these kids, 50%, aren't sent for follow-up with either their pediatrician, a pediatric neurologist, a concussion specialist, a neuropsychologist. There's any number of people who can follow these kids up. But the end result is they need to follow up with one of them. Cognitive testing ongoing can help determine how significant this concussion has been, because it's no longer a retrospective analysis of concussion. We don't know how serious and significant this concussion is until we get that prospective information. How do they do over the next days, weeks, or months? And then the question of brain rest. We have no good answers. I'm going to tell you my little bit of biased way that I go about this. I encourage children to have a graded return to play, much like that pediatric study tells us, that strict brain rest is not the way to go about things. But rest is important nonetheless. We put ice on a bruise. I put ice on the brain. How do I do that? Is I ask these children to limit two-way interaction for the next 24 to 48 hours. And what is that? Anything where information comes in and you immediately put it back out. It takes about 10 seconds for kids to realize that those are all the best things. This is video games, texting, TV, right? Oh my God, if you're getting information and immediately transmitting information out again, we don't have great data, but it seems like that might be what we need to avoid in terms of brain rest. We do need children to engage their brains as soon as possible, but it needs to be in a graded and slow return to play. That's about it, right? So concussion, make the diagnosis, consider the Zurich concussion tool, but understand that it's a relatively non-specific and it's a tool that's subjective and open to interpretation. Get your kids follow-up with a concussion specialist, a pediatric neurologist, a neuropsychologist. Consider a more graded and a more rapid return to play when appropriate, and then speak with them, speak with the families that continued symptoms at 1 month is really the norm for many of these patients. And that's the end. I'm out of here. So thanks very much, guys. Appreciate it.